We have here a ruptured silicone implant. It's a silicone shell, the same shell that we have for both saline and silicone. Inside, okay, is another silicone material. It's more like a gel-like. I mean, you could see the shell right there, and then you can actually see the actual silicone. Now, the good thing, and maybe the bad thing, is that when they're ruptured, you can see how big this hole, this gap is. We don't have silicone pouring out everywhere. It's still in there, and even if there's a little pressure, look at that, there's a little bulge, and then it bounces right back. So you could go with a big rupture, not even a little rupture, for a long time without even noticing a difference at all, which is not a big deal. However, sometimes some people will have a little reaction, because you can see this is a little bit sticky there. Okay, not like crazy, but that might cause some hardness of the actual shell, or not the shell, the capsule around your implant, because your body's going to form a natural kind of protective barrier for anything that goes in there. Most times it's very soft and you can't even feel it, but sometimes this will cause it to get harder, or it might change the shape a little bit, because like if it's sitting under a little bit of pressure, there's a little bulge. So if something changes and you have a silicone implant, then we definitely need to explore it, because you're not going to be able to tell right away. And the way to do that is with an ultrasound or an MRI, and then they will be able to detect this kind of rupture. With a saline implant, you know right away, because a hole this big is going to make sure that all that saline, that salt water, is going to come out, and your body's going to absorb it, and it's going to look like you had a flat tire, no question about it. But the silicone, good news is it stays in there, it's maintaining its shape. If there's a little pressure, it bounces right back in, and so it just needs a little bit more exploration if there's symptoms.